Thank you, Chairman Hennessy. Chairman DiGirolamo, the Human Services Committee.
Good morning.
Good morning.
Welcome. One big happy family here today. Appreciate you taking the time to be here. We've got a major disagreement on this consolidation plan, but I very much appreciate the good work that you do every day in your jobs. I know you all feel very passionate about the people that you serve, and even though we have a disagreement on this, hopefully we can work on things in the future as we have in the past. I offered you a sticker. I'm going to offer again. Nobody wants to put a sticker on to keep the Dept? No? Okay, no takers. I would first like to recognize the presence of a good friend, former Secretary of Dept, Gary Tennis, who's with us today. Gary, welcome. We really appreciate you being here. And very much appreciate the good work that you did in the time as Secretary. And just a couple of things you've done. I mean, with your work on the Narcan, going around the state raising money and talking to people. I believe we're close to 3,000 or over 3,000 lives that have been saved in the state of Pennsylvania because of the Narcan. And I know you started that drug take-back program, and I think right now in the state we're up to over 100 tons of those little pills that have been taken back across the state. And I know we're two of your initiatives that, I think you're very proud of, and so are we. So thank you for being here, and thank you for your good work. I don't know, where do I start? I know you had a hearing over in the Senate, and a couple of the senators point up a good point. I mean, I know Senator Jean Yaw brought up the point that the legislature, and I'm going to concentrate on Dept, the legislature back in 2010 enacted Dept. And, it just started up in 2012, and it's still in its infancy. It's only 5 years old. I mean, and I think his question was, which is my question, you think we did something wrong in the legislature? I mean, Governor Rendell signed it into law, Governor Corbett, it was a bipartisan, almost unanimously passed in the House and the Senate. And do you think we did something wrong by doing that? I mean, I don't know. If anybody want to, Jen or Ted, do you think we did the wrong thing?
I certainly wouldn't venture to offer an opinion on a decision that was made many years ago. What I can say, Representative, is that we have to look at what's currently happening here in the state and make the best decisions that we can based on the circumstances that we're presented with today.
Okay. Something else that came up in the Senate hearing, and I know in your PowerPoint presentation you pointed to Texas as a state that has done this. It's in your PowerPoint. And I think one of the other senators brought up the point that, yes, maybe Texas is doing this, but they started in 2003 to do this, and it's still not fully implemented. And I think one of the senators actually had the law, and they're still only in kind of like phase 1 or in phase 2 of implementing, and it's 14 years later. And my understanding is, I mean, you think you're going to do this like right away, as soon as the budget's passed, and you're going to implement this. I mean, isn't this going to take some time? Teresa, go ahead. You look like you want to.
I do, only from the standpoint, Mr. Chairman, that, Texas, and I had great appreciation in the Senate hearing that the fact that Texas was brought up. That was one state that I have reached out to my colleagues there during the course of the last few months that this has been under consideration for Pennsylvania to learn from their experience. While Texas has a different demographics than we do, one of my concerns is what you just talked about. And as Jen used in her PowerPoint presentation, any process of transformation and creation and culmination of health and human services coming together across 4 state agencies like Pennsylvania is poised to do is not a culmination on a certain date. It's a transformative process that's going to have to occur over time. With regard to Texas, while they started their process in 2003, 2004, because of state legislature being passed in order to take their health and human services from 12 agencies to 5, during the course of time leading up to 2014, 2015, and their legislature only meets every other year, so they're even a different structure. They also don't have cabinet secretaries. So back a few years ago, 2014, 2015, another piece of legislation was enacted in Texas that now is allowing Texas to move their Health and Human Service Commission plus 3 other commissions that are in their bucket of human services in their system in Texas to take their agencies from 5 to 3. So it has been a transformative process for Texas that certainly we need to make it work for Pennsylvania. But learning from their experience and expertise, their stakeholder engagement, their collaboration with their General Assembly is paying great dividends for us in terms of how we move forward here in Pennsylvania.
Okay, thank you. I mean, me and Representative Seth Grove just this week circulated a co-sponsorship memo on a bill that would mandate legislative budget and finance and joint state government together to do the financial aspect and the program aspect of doing this, and come back in a year and do a study on whether what you're proposing is feasible or not. I mean, that makes all the sense in the world to me. And then after the study's done, they're supposed to present the studies to the standing and proper committees in the House and the Senate, and then let the legislature have a look at this. I mean, that would make more sense to me than actually just jumping into this and implementing it. One thing I do, and I'm going to close with this real quick, Matt, if I have another 2 minutes. I want to show you a chart, and it's from your budget booklet, your proposed Health and Human Services Committee. And I would like the members maybe to take a look at that. It's in the corner. This is what this new Health and Human Service Committee and bureaucracy will look like if it's enacted under the proposal that the administration has made. If you look, and I've just got DDAP up top, you have the governor, and then you have the secretary, kind of like reporting right to the governor. Under the new proposal, you're going to have the governor, then the secretary, then Rachel, I guess you're right here, the physician general, right with the secretary. Then you have, I think, these 9 or 10 offices that are there. And then underneath the offices, you have an executive deputy secretary, and then you have 2, 4, 7, 10 different deputy secretaries. Now, if you're worried about drug and alcohol, here's drug and alcohol all the way down the bottom, and it doesn't even have its own deputy secretary. It's a deputy secretary for behavioral health and substance abuse disorder. And if you're worried about our senior population, which I think we all should be, here they are down here, a deputy secretary for aging and adult community living, buried in this large bureaucracy. In my mind, this is not what I want to see for Pennsylvania. I would much rather have Secretary Osborne advocating on behalf of the seniors, reporting right to the governor. I would much rather have Secretary Smith reporting right to the governor, being able to get a meeting instead of being buried down here in this large bureaucracy. I mean, I've been from the very beginning, I don't like this at all. But here's from their own budget booklet, and here's what it looks like. And if you're a senior citizen, if you have behavioral health problems, if you're a drug addict, this isn't what you want to see. You want to see somebody that's advocating for you and having a secretary in these issues. So I'm just going to.
If I may comment?
Yeah.
So
Dr. Levine.
Thank you.
Please do.
So that organizational chart that was released was really just an initial draft and kind of a placeholder document. Since that time, the governor has said that there will be a cabinet-level official that will be addressing substance abuse issues, particularly the opioid crisis, that will report directly to the governor. I know that in the past, people have said, well, what agency would that person be in charge of? And so the person would not be in charge of an agency. The idea that they'll be able to work across this agency and with other agencies as well. it would be rather similar to my position. So I am a cabinet member. I'm in the Department of Health, and I don't have an agency that I run. But I have been able to advocate for opioids and other issues, but particularly in terms of the opioid epidemic, in terms of the standing order for naloxone and many other issues. Been very pleased to collaborate with all of you. Pleased to collaborate with DDAP and with previous Secretary Tennis, and now with Secretary Smith. And so I think that the people are calling it the drug czar. I don't know where that came from, but the cabinet level official would report directly to the governor and would have responsibility for coordinating efforts across this department as well as other departments. So the governor, of course, as you know, is committed to addressing the opioid crisis and has worked tirelessly with the General Assembly to address this, as well as with all of the agencies. It's really been all hands on deck. And so I don't think that you have to, I think it's important to reassure the General Assembly as well as the public is that the governor is committed to continuing to addressing the opioid crisis, and the larger agency would be really the best way to address this. I would agree exactly with Secretary Osborne that this isn't an ending process in July. In July, the consolidation would begin, and this will be a continuous effort in terms of continuous improvement and consolidation to coordinate and streamline services. To give you one example of how we've been able to work together now and could work together in the future, I'd like to point out our grant proposal for the 21st Century Cures Grant. As you know, the 21st Century Cures Grant, which was a grant process from the federal government at the end of 2016, will provide $26.2 million a year for 2 years, so a total of $52.4 million to address substance abuse disorders and particularly the opioid epidemic. It's a grant from SAMHSA. The 4 agencies all work together to be able to do this and submit this grant. We utilize and leverage the excellent grant writing services that are present in the Department of Human Services and able to pull together all the different proposals. We hope to do a needs assessment, coordinate data, which is actually able to do much better when we are able to break down those silos, support PDMP EHR integration, maintain a hotline, develop PSA messages, increase providers, expand medication-assisted treatment through a new program called PACMAT, and increase efforts in schools. So this was able to be done and is an example of the collaboration that we all could do, which we're able to do even better when we're one agency.
Okay, thank you. And I'm just going to end like this. I appreciate it. I actually feel, I mean, that drug czar, in my mind, with no staff, is going to be no more than a public relations guru that's just going to go around the state and just tout how good everybody's doing in the administration. I don't think that's going to be any more than a public relations person. And I kind of feel bad for some of you to have to defend this. I mean, you're exerting all this energy and time when we could be doing so much more on positive things. I really feel bad for you because my guess is you all don't have your heart in it. And I know the administration thinks that it's just me and a couple of people that are opposed to this. But I'm going to tell you, you wait till this thing gains a little bit more legs, you're going to have a public relations disaster on your hands when the human service community and the aging community finally figure out what you're trying to do with this plan. So thank you, Mr. Chairman.